my name is Eugenia. Thank you for joining me today. So, I've been a nurse for about 3 years, and I wanted to share with you some of the positive and negative things in nursing career. Again, this is not meant to bash a nursing career. I'm not here to complain, but I wish when I was brand new, someone would share those things with me so I wouldn't be taken by surprise. But I want to tell you everything as is and not to leave anything out. So if it sounds interesting to you, please keep watching. All right, so let's start with the positive things. Nursing field is definitely in high demand, and with everything going on, that's probably not going anywhere anytime soon. There are always going to be sick people, so this is a job that's never going to go out of style, and you most likely to always have a good job and secure position. You're definitely going to have a lot of opportunities. One of my favorite things about nursing is how many different options are out there you can choose and pick from. So if you don't like one field, you can safely switch to another one. You can work with geriatrics, you can work with pediatrics, neonates, you can do surgery, you can do outpatient clinics, you can do dialysis clinics. So there's so many things to try. There's also things like teaching, advanced practice nursing, like family nurse practitioners and acute care nurse practitioners. So there's so many things, even anesthesia. So those are just a few of many options, and nurses are needed everywhere. You definitely get to help others. That should be one of the main motivations to become a nurse. It is definitely a career of giving. Day in and day out, you're giving part of yourself, taking on the struggles and hardships of your patients, helping them to resolve them, helping them in every possible way that you can. And it's a very selfless job. So it's definitely shouldn't be about money, which when you start doing all these things, it doesn't look like a lot of money, honestly. But it's definitely will be fulfilling if you want to help people in a meaningful way. Benefit of flexible schedules and PRNs or part-time positions. This is amazing because, as you know, we work 12-hour shifts most likely, except for some outpatient and special procedures settings. But usually you get your full-time hours, which is 36 and above, so 3 12-hour shifts in 3 days, 3 nights, right? Or 3 days. So you can use 4 days doing whatever you need to do. And you can be off on weekdays. You can have doctor's appointments or some home maintenance appointments, and you can make it work. If you stack 3 days from the previous week and 3 days of the new week and work 6 shifts together, which is a lot, I'm not going to lie, you can have the other 8 days off so you can actually go on vacations without taking any PTO. Steady income, we kind of covered it. You're most definitely going to have a job that has pretty set income. It's not like being a freelancer that you have to search for your own clients. It's all going to be set up for you, and hospitals are never empty, trust me. You get to wear comfy scrubs. You don't have to think about what to wear to work. You get to experience great teamwork. Interdisciplinary teams work together for the benefit of others, and you learn so much. Always learning, that's for sure. You never know too much. There's so much knowledge out there, so much equipment, so many specialty topics that you will just be soaking it all up as a sponge once you free on your own, right? But yeah, it just never ends, no matter how many decades you've been a nurse. Building relationships with patients. That's definitely something amazing that you can have. You get to know them in a very special way. They share things. People do tend to open up and tell you things that sometimes they don't tell their family members, you know? So it's very beautiful. And sometimes you get to have the same patients over 3 days course. So you really are with them for 36 hours and you kind of create a bond. Or like if you work in the outpatient dialysis clinic, you get to see those people come back 3 times a week for up to 4 hours of dialysis, right? So you get to know them and be friends with them. So that's very unique. You can save lives with your interventions. So that's something that, office person can never say. So using critical thinking and recognizing subtle changes in patients' conditions definitely can save people's lives because nurses are the ones there all day long. Doctors come and go. They might be there for just a little bit, but you're the one staying with them and you get to notice all these things. So we definitely affect patients' outcomes in a good way. No 2 days are the same. You're definitely not going to be bored. So that's good if you like that. And if you like adrenaline rush, nursing can be a really good career for that. It's pretty respected, of course. Any healthcare position is respected by others, by most people. Your salary is going to go up over time according to experience that you will have, and it's a great opportunity for overtime. So they always need nurses. So if you wanted to get some overtime shifts in, you will have it for sure. And there's also an opportunity for travel assignments. That's a whole another topic if you'd like me to cover that. Kind patients, not all patients are amazing, but most of them are kind and nice, and it's very fulfilling to take care of them. And it's very nice to see their recovery, especially if it's after some major intervention and you see them leave, and or if they downgrade from like ICU to another unit. You might not see them leave the hospital, but you know that they're not back in ICU, so they must be doing okay. And you're really making a difference. You get to practice critical thinking. This is major. You learn quickly how to think on the spot. You're constantly paying attention and you analyze everything you see. And that kind of keeps your brain sharp. You get to teach and educate your patients and help them like identify the weak spots about their health management. And that's also cool because they might not have an issue with that right now in the hospital, but once they go home, they can apply those skills to health management. You get to learn unique and pretty awesome skills. You get shift differentials, which is like weekend differentials, second, and in some places it's second shift differential also, but most just do night shift differentials. So if you work like weekends and nights, you get the most pay, and it's pretty tangible difference. And most nurses get to enjoy affordable health insurance. It's not super cheap, but it is still much cheaper than the private insurance. Let's talk about some negative things, okay? Please don't be hard on me. I'm just trying to share, and I feel like to save you guys from heartbreak, it's better that you know going in what it is going to be about than to be in the middle of it and be shocked or surprised, because they didn't mention it in nursing school. So this job is hard on your body and it's very hands-on. You're going to be doing procedures to people. You're going to be inserting catheters. You're going to be doing wound care and stuff like that. So it's hands-on, and it's usually observed by family members or by your coworkers or by other team members. You have to grow that confidence. It's also long 12-hour shifts. It's pretty long, but it gives you that flexible schedule that we talked about. So some people find it a lot better to just work 3 days than to stretch it over Monday through Friday. And those shifts start early in the morning, so you have to be at work at 6:40, the latest. So that means you have to wake up, get ready. If you're a girl, you have to do your makeup or whatever, get ready, travel to the work location, go up to your unit, and be there at 6:40 a.m. Or you have to be up all night if you work in night shift. So that's something to remember. And of course, night shift, it's a lot to take in when you have to switch to staying up at night before work and then sleeping in during the day off following the work shift. Exposure to contagious diseases and gross things we do. Definitely do those things. I have to. Nursing is like that. You are exposed to diseases like TB, Hep C, HIV, different viruses that might be still undiagnosed when patient just comes in. MRSA, that's antibiotic resistant. C. diff is a big one. And now, of course, this thing that we all know is out and about, and a lot of nurses don't have a choice but to take care of those patients. Bodily fluids exposure. I'm not sure what the word fluids went, but yes, blood, urine, stool, you'll have it on you. You'll have it on your gloves, no matter how careful you are. Well, gloves, obviously, yes, but most times you're pretty safe, but you have to see it, you have to feel it, you have to smell it, and it might get on you. You don't get as grossed out by it as time goes by, but it's pretty disturbing at first. And also the mucousy, sputumy stuff too. The con is a lot of years of education. It takes time for bachelor's, for associate's degree, 2 years, advanced practice is another 2 to 4 years, plus the time it takes to get prereqs and study for admission tests. Not all places have them, but some have admission exams. This job is stressful just because depending on the shift and how it goes and what all happens, you can be abused by hard patients, and by hard, quote unquote, I mean, there's just some patients that never happy no matter how hard you try. And it might be due to different reasons, it might not be related to you, but they express it on you. So that's sometimes hard, or like people with dementia that forget where they're at and think you're trying to do something to them and swing at you or try to bite you. There are patients with mental health issues, so that can be scary sometimes. But most of the time it's not like that, but just be aware that it can be sometimes like that. Short-staffed units and increased patient ratios. That's also important, and please make sure before you start working in that place of employment, maybe go there, talk to some of the employees, see if you can read reviews or see what their staffing ratios look like, because you don't want your practice to be risky. You don't want your license to be on the line, or it to be unsafe for your patients. So it would be good to find out what are the accepted ratios in that unit that you're planning to work for. Increased level of responsibility and legal issues. That's something important too. Partially why this job is so stressful is because it's not just person's life that you're responsible for. You're also responsible for your license, and you can actually get yourself in jail if you don't act appropriately, professionally, or cause harm to your patient. So it's very important, and it's something that doesn't really go away because you always have to be on your tiptoes. You always have to do your best. You always have to pay attention because it only takes one mistake, And a lot of nurses that did mistakes in the past that did not lead to any legal action still had severe depression and aftermath just because they could not live with thought of causing harm to somebody. You get to see traumatic and painful events, including deaths. So sometimes you do everything you can, but you cannot save all. And it's really hard, especially if you get attached to people. And especially in the beginning, you are a caring person. You went into nursing to help others, and now you cannot save someone, and they seem like a very nice person, and it's just hard to let go. It's hard to see families crying. It's hard to see them dying, pronouncing death, bagging the bodies, calling the organ donation services, calling the police for autopsy. So those are the things that we do, and it gets easier. It's an honorable thing to be the last person to take care of that human being that lived life and experienced life and been someone, mom or grandma, grandpa, But it's definitely sad, and if you're too sensitive, you take it home with you and you struggle, and then you try to be strong and mighty and not to take it in hard and just, what doesn't kill us make us stronger. And then you don't like the person you become. So it's very thin line between compassion and empathy and kind of still caring and doing everything you can, but knowing when to let go and not take it home after work. But there will be times that you'll be driving home crying, you'll be rethinking everything, thinking if there was anything else that you could have done. And it's normal. We're human beings, we're loving creatures, and it's something that comes with the job, unfortunately. Working weekends and holidays, that's definitely something I did not really hear when people were saying in nursing school, because it would be some time later, not yet. And I see a lot of that in the new nurses that I train, or like new hires do residency with me, that they're not prepared for all the sacrifices it will take. So it is important for you to know that you will be required to work some weekends of the month. So that means that you might have to miss some of the outings or events with your family. And of course, you can swap with the coworkers, but you won't be able to swap every weekend. So that's not going to be an option. And missed holidays too. So nurses are required to work some of the major holidays. There are not many that are acknowledged by hospital systems. So like Easter, 4th of July, stuff like that. That's not something that you'll get a double pay for, but they will require you to sign up to work some of the holidays. And then for winter holidays, there's a whole another schedule. And usually people with more seniority get the first pick. So if you're a new nurse, most likely you'll be working Thanksgiving and Christmas Day, and just prepare yourself mentally that you might have to miss out on those things. Nurses eat their young lateral violence. It's not as common anymore, and it's something that should be reported, but sometimes it happens that if people don't like you, they can treat you differently. And if this happens to you, please make sure to talk to your supervisor. 5-star service goal, not complete healing. So that's something I struggle with, because the way hospitals get reimbursed for these services is no longer based on the patient outcome as much as on patients' feedback about what their experience was while in the hospital. So it became more important to bring that water and ice faster like that than actually continue to do what you're doing to try to save that person's life, Of course, hospitals want to be paid for the work they do, so it's not like it's their fault or anything. It's just the way it's set up is a little bit strange. But just be prepared that it's kind of like a 5-star service, so you have to make sure that you take the heat if person is upset, that you try to be as kind as possible, and that you might have to leave what you were doing and do this just to make sure the patient is happy with your service. Adjustment period takes about 1 year. So it's an average takes about 1 year for a new nurse to feel a little bit more comfortable in their shoes and in their skills in talking with patients, and finding priorities and learning the protocols and stuff like that. So that's another year after you graduated and passed your boards to still kind of feel like brand new nurse and kind of lost, but it goes away, I promise. No set schedule. So that's another thing we talked about, flexible schedules. Usually schedule is made 1 month to 2 months in advance, but if you plan a vacation for months ahead, you don't really have the same schedule every week, so there's no telling. But usually it's workable, and if it doesn't work, then you can switch with your coworkers and make it work that way. Sometimes nurses are underappreciated by doctors or other workers, so it is kind of that way. Sometimes, for example, residents can be pretty kind and nice to you and try to pick your brain and get all the information they can, but then when they come back and do report to the faculty, if anything's wrong, they're just going to throw you under the bus, or if you call a doctor at night for something they don't think is important, it can be pretty mean. And again, it's been getting better, but things still happen, and you can get yelled at or blamed for something you didn't do. You're just still kind of that middleman between doctors and physical therapists and respiratory therapists and occupational therapists and dietitians and case managers. And on this side, you have patients' needs and their patients' families' needs. And then you still work with your coworkers, so you're really in the middle of everything that's going on. And no matter how hard you try, sometimes some of these people end up being unhappy with you. So it's not necessarily that you do something wrong, but just learn and think about it from get-go to not take it close to heart and not take it personally. Healthcare can be stressful, and while it shouldn't be that way, sometimes it is that way, but it most likely is not your fault. Nurses are underpaid for what they actually do. We do fulfill a lot of orders. Yes, we're not making all the calls, but we do a lot hands-on, and we do a lot of important things. We do a lot of dirty work. We're not getting paid nearly as doctors do, and I don't expect us to be paid that way, but I still don't think that what they're paying us is appropriate for what we actually do and how much stress we carry and how much responsibility we carry, because that's what makes it worth it or not worth it, because it's someone's life, and one mistake can take everything away from you. And lastly, weight gain, short breaks, and sleep deprivation. So basically, if you work night shift, even with days, because of the stress and short breaks or just eating unhealthy when you have like 15 minutes to eat and you stuff yourself full real quick, or if you work night shift and you have to eat lunch at midnight or something like that, so it kicks off all your circadian schedule and stuff, people tend to gain weight. So nurses are not the healthiest people, surprisingly, because we put people first, sometimes end up putting ourselves last. And things that can be a pro or con depending on how you look at it. Leadership and hospital systems, some are better than others, of course. Regulations and policies, usually it helps us to define our scope of practice, what we should do, what we shouldn't do. It makes it clear as far as what steps to take. But sometimes they're ridiculous and really illogical and they do not make sense and complicate your life. So it can be both, depending on what it is. A lot can happen in 12 hours. Of course, some shifts will be easier than others, and some just like all hell broke loose and you just don't know where to start and you want to pull your hair out and you don't know how to be at 10 places at once. And of course, growing cold or being emotionally torn or burnt out. Like I said, some people get stronger and I guess less sensitive, and some people count it as strength. Or on the other hand, if you're taking it all to heart, it can actually hurt you. It can hurt your mental health. It can make you depressed. It can affect your sleep and just overall happiness. So it can be both things. You definitely learn and grow as a person, as a team player, as a healthcare professional. It takes a lot of gut to keep going. So this is it. I hope it was helpful. Please let me know if you have any questions. I'm going to continue with nursing topics. And if you have any suggestions about what should I make the next video about, please let me know. I'm here to stay. I'm here to help you as much as I can. I love what I do and I love supporting my new nurses. Again, thanks for stopping by on my channel. Stay healthy and happy and have a good day. See you next time. Bye.